Greetings, this is the Cancer Interviews podcast, and I'm your host, Bruce Morton. From time to time, we have to remind you that men get breast cancer too. In addition to all the daunting challenges that come with the disease, there are some unique problems faced by men when they are diagnosed. Our guest on this episode has survived stage 4 breast cancer. He is Guy Nakoa from Wailuku, Maui, Hawaii. Now it's time to hear his story. And Guy, welcome to Cancer Interviews.
Hello, everybody. I appreciate being here, Bruce, with you and kind of talking about something that's really important to me. I was born and raised on Maui. Absolutely love here, but love being here. But it only took me 62 years to really appreciate what I have. So it's really privileged to be here.
Wonderful. Now we want to start with your cancer journey right at the beginning. For all of us who have survived cancer, there was that point in which we thought our health was normal until it wasn't. We noticed something wasn't quite right. For you, when did you first notice that something was wrong, and what went wrong?
Great question. I first found my lump in 2000. So I was doing a summer internship in Alaska. So I was working for Princess Tours, a wilderness lodge. And I was taking a shower one day, and I was like, "Whoa, what was that?" I was like a little pain there, and then I realized, wow, there was a lump there. And at first, I thought, like, "Oh, men don't get breast cancer." Now that was my first initial thought about it. And for the next 12 years, I didn't say a word, didn't tell anybody about it because I was too embarrassed to talk about it. It wasn't something that I was comfortable with. And it was around that age where the internet was kind of first taking off, and I kind of didn't really know my way around trying to get online and trying to punch up the information that I needed back then. But there's so many things that I've learned along the way when it came to that. But the initial thing was I didn't have breast cancer. I wasn't a woman, and then I was just in denial at that point.
Guy, I have to ask, you noticed that something was wrong, but you didn't take action right away. In fact, you mentioned for 12 years. But from a mental health perspective, how difficult was that, knowing that there was something wrong, but you didn't act on it right away?
It's tough to describe, at the time, because there was a lot of things kind of happening in my life, so I really wasn't paying attention to it. I was a young culinarian at the time, so I was trying to make my mark in the industry, and so all of my focus was there. I had a young family at the time. My daughter was young, so there was a lot of things that I was balancing. My wife had some health problems on her own, so trying to deal with that, trying to get her squared away with disability and that at that time, and then kind of being a dad was a huge mountain to climb at the time.
Before we go any farther with your journey, would you say to anybody else who found themselves in the position you found yourself in the year 2000, would you advise them to seek medical attention right away?
Oh, yes, definitely. I mean, most definitely. I'm the lucky guy that being able to sit here today and making this video and talking about it. So, think about it, like this is 25 years later. I'm still alive. I'm still here. So I think that's what really makes me focus on, kind of talking about it and being a bigger voice about it, because I was one of the lucky guys that actually had it. So, yes, would I definitely recommend that getting treated right away or getting checked right away? Yes, I talk about that now. The important yet.
By the way, we're confident you'll be able to learn some tips and tools to help you through your personal cancer journey. But first, we'd like to invite you to please give us a like, leave a comment or review below, and share this story with your friends. Kindly click on the subscribe button below and click on the bell icon. That way you'll be notified the next time we post a cancer interview. And we want to remind you that on the Cancer Interviews podcast, we are not distributors of medical advice. If you seek medical advice, please consult a licensed healthcare professional. Now, Guy, you mentioned that it was 12 years before you sought medical attention, but when you did seek medical attention, what did you learn? What were you told?
I didn't decide to reach out until like around maybe 2014. The doctor that was, a doctor for pretty much all of my daughter's life was a really close doctor and friend of ours by this time. And I had divorced my daughter's mom by this point, so I was kind of on my own. And then I went to him to go talk to him about this lump I had on the side. And then he just looked at me and he just blew it off. He just said, oh, they're just, fat deposits that you get accumulated over time. And, I was in total denial. I was like, yeah, that's good news to me. I don't have it. But, he made a misdiagnosed at that time. I don't think he kind of knew that men could have it.
But there was a chain of events eventually that led to your diagnosis. What was that?
So by this time, 2015, I actually had another doctor. So another doctor, the cancer lump has grown now. So it's pretty big now. So it's really noticeable. It's almost it was at the size of a penny and right around the size of a dime now. And now it's kind of like it's rubbing up against me. So I went going to go see him. And he thought it was like an eloid. So he thought it was an eloid, like a sun cancer that you have on the top of your skin. And I'm just like, I don't hardly get any sun, so how would I get that? But anyway, so we went and did it. And then the oncologist at the time, the nurse asked me, that person out there, is that somebody close to you? And I was like, oh, yeah, you better have her come in the room. So I already knew that it wasn't going to be good news. And when we walked in there, I actually told my friend at the time, whatever news we're going to hear, we're going to act like we knew all along. I don't want her to break down and start crying, because if she does, then I'm just going to fall apart. So luckily for me, she was able to stay strong through it. But yeah, definitely it was positive.
Guy, in retrospect, would you say that the lack of, there's probably a better way to say this, the lack of speed in your getting diagnosed, you're being misdiagnosed, do you think some of that had to do with your being male? In other words, if you were female and that same lump was detected, there would have been a diagnosis right away?
I think so. I'm seriously, it would be, people would look at that, you know what I mean? Because it's so common. And it wasn't really, it was right on my breast. It was like to the side. So I don't know. I don't know what that is. But I think, yeah, because I was a male and, maybe there wasn't a lot of studies of it back then. Yeah, I could see how it was overlooked like that.
Now, we already know that learning that one has cancer, that's horrific news. We already know that. But in your case, because you were diagnosed with a type of cancer that is generally not associated with men, was it kind of a 1-2 punch for you? In other words, you got this bad news, but I've got to imagine there was a certain amount of shock that came with your learning that you had breast cancer. Was that difficult also?
It was pretty difficult to accept because of the rarity of it. 1 out of 726 men, have a chance of getting it. And here I was the guy that hit the lottery. So I wasn't walking around feeling like I was the champion of the world at that time, because even through all of that and my cancer, it was kind of weird. Like when the lady did my biopsy at the time. So my cancer the lump was just pink at the time. But when she took the biopsy 3 days later, it just turned green. Because I guess it was oxidized on the air and everything. She never covered it, but it was like totally gangrene. And I was like, wow, this is serious. But it was hard to deal with, definitely.
Well, I do know that different cancers are different, and whereas with some diagnoses, there's only one way to go in terms of treatment. As a prostate cancer survivor, I can tell you that there are numerous options that one has when they're diagnosed. And in my experience, just doing these interviews with breast cancer, I've heard that there are numerous options, numerous ways to go for you. So for you, Guy, what were your treatment options?
Well, when I first did the surgery in 2017, so that's when I did it, all I wanted to do was just the surgery. And then I had to go through an 8-week cycle of chemotherapy. And then they wanted me to do radiation. I was against the radiation at the time. And again, lack of knowledge, where I am, I don't know at that time, but I was just trying to get through it. So that was the options that was given to me, just that two at the time. And then, they never had me on any medicine yet. So I wasn't taking any cancer medicine at that moment.
Now, when you went to a facility to get treated, did you find yourself in a facility that dealt with breast cancer, but because breast cancer mostly affects women, were you in a place that wasn't really, a facility that wasn't really prepared to handle surgery for men with breast cancer?
Well, where I had my treatment done, it was actually at the hospital where I had my surgery. And it was in a big room. I mean, there was, a lot of, chairs there where everybody could have done their treatment. But the staff there they treated me like everybody else. It was awesome. So I never felt out of place or anything like that. I was just like everybody else they were treating. So that was awesome.
Now, as far as your chemo is concerned, do you remember the type of medication you were on for your chemo regimen?
No. Again, I mean, that was the thing. Okay. That was the interesting thing. And looking back at it, I should have really got that information. When I first got initial, diagnosed, I never asked my doctor, what stage or, what is it? What is it about? I never asked anything like that. I wasn't asking about, the chemo things that it was using. I was just in denial, just totally out there and out of space.
Well, as far as chemotherapy is concerned, it's never pleasant for everybody who undergoes it. I think there are varying degrees of unpleasantness, if there is such a word. For you and your chemo regimen, Guy, what was the toughest part?
Well, that's interesting because I did 2 chemotherapies, so 2 chemo treatments. So I did one in 2017, and then I moved to Ohio in 2018. So halfway through 2018, I moved up there. My daughter lived up there, and I went up there to be with my grandson. My cancer came back. So my side of my chest started kind of caving in, and I was like, oh, what is that about? So when I went up there and started getting help for do it, my oncologist at the time told me my cancer came back. So the chemo that I did on Maui wasn't good enough. I should have went through the radiation to try and localize it. I didn't know again. So I had to go through a new treatment through the whole thing. And we talked about the options of what we was going to do. We're going to do chemotherapy, then we was going to have surgery, and then, we was going to have radiation done, then we was going to have surgery. So when I was on Maui, when I did my treatment and they would give me the medicine, I just fell asleep. I was just so exhausted, but it was the effects having it where my brain felt like it was on fire. My energy levels would just drop low, like 3 or 4 days after that. It would drop low, and then I would have to go back and then get on white platelet shot to keep my cells, good. But yeah, it was a tough time because it was like a 2.5 week process before I went back for my next treatment.
So obviously that was difficult physically, but how about the mental and emotional piece of all this? How difficult was that? Did you feel like there was going to be light at the end of the tunnel on this, or just emotionally, was it just really crushing?
Well, when I was thinking about cancer back then, I just thought like, I'm living on borrowed time at this point. 2017, I went through the process. I was trying to stay out of the sunlight during the day because you can get sunburned from the chemo treatment itself. And I slept a lot. I slept for like 2 or 3 days. Like I didn't get up. I lost my appetite. My anxiety was through the roof at that time. But I just isolated myself. I didn't want to be around nobody because I felt like my immune system was compromised. and I didn't want to be around anybody that could get me sick.
Okay, but your journey took yet another turn in 2024 when you opted to get a mastectomy. And if you would talk about what led up to that and what the procedure was like.
So shortly after I left Ohio in I came back home. I moved back to Maui in 2020. So when I came home, after I did the treatment up there, I actually asked my oncologist there. So I had my daughter in the room at the time and asked my oncologist, like, what my life expectancy looked like. And he just told me, oh, you got 5 years left, what do you mean worth it? And I was like, what? And I just told him it depends. But I kind of knew that the stuff that we wanted to do up there, he said we couldn't do it. We couldn't do the surgery. You couldn't do the radiation. You're gonna have to just take meds for the rest of your life. And I came home in 2020. I came home right before COVID when it hit Hawaii. I was back home at the time.
And do you remember the kind of medications that you had to take? The medications they said you'd have to take for the rest of your life?
At that time, I was taking Ibrance and Tamoxifin. When I came home from Ohio. And the good thing about it was when I finally came over back home, and then I really had a good oncologist when I was back, Dr. Okazaki. So he was really a guy that really gave me a lot of hope because of what we was doing. So being that the tamoxifen wasn't giving us the results we needed, he told me that sometimes if we switch the medication to using the women's breast cancer medicine, we might have better results. And I trusted him by this time. I told him, Doc, I trust you to this point. Let's go that route. And as soon as I started to take that medicine, which was the Letrozole, so when I started taking the Letrozole and the Ibrance in combination, my numbers started to go down. So immediately, like within 2 weeks of me taking it, I could tell that the numbers was going down. We was checking, more often, and he would show me the numbers that they was concerned about was going down. So that was a really positive step in the right place. But we already got to that point established at the end of 2023. Dr. Okazaki recommended for me to go have radiation done. So, by this time I trusted him. We was together for a couple of years. And I said, yeah, let's go do that. Let's finish it. So I went to the Pacific Cancer Institute of Year on Maui. And I went in to go talk to them about my radiation. They remembered. They remembered me when I was diagnosed in 2017 because I went out there to go do the measurements and get ready to do the radiation at the time. So when they came back then, the technicians and everybody knew, like, oh, yeah, we remember when you came the first time. But when I went this time, I was talking with, I forget what his name, the doctor that was in charge of the institute. And he actually recommended me for go on, we'll talk to this other surgeon on the island of Oahu. And I was like, wait, come on. Sorry about that. I had to go to Oahu. So I did a video call with him, and I kind of showed him where my cancer thing was. And he was like, oh, yeah, we're just going to have to go in there and do like a little procedure. And they're going to take like 20, 30 minutes. And then that way we know when we're going to go in for the radiation. That place was already kind of like just cleaned out. So I'm like, oh, yeah. So he tells me to fly over and then go meet him so we can really set up everything on Oahu. And I was like, oh, okay. So I get there. And then he comes in the room. He goes, oh, no, we're going to have to take your breast off. I'm like, whoa, wait a minute. That's not what you told me on Maui. And he was like, oh, yeah, we're going to have to take your whole left breast off. And we want to make sure, we want to make sure. And by this time, I already was in denial all this time. Now you're asking me to remove my breast. Now, not only am I dealing with cancer, my mental state is messed up. And then now you're telling me to remove a piece of my body when I'm going to look in the mirror like you again. Like, it wasn't funny to deal with, but when it came out of the doctor's office, and then I came downstairs, for some strange reason, Kaiser kind of was like the medical group that I had to get my medicine was calling me to talk to me about my medicine. I was like, yeah, that's cool. And then they're like, oh yeah, Dr. Okazaki retired. And I was like, wait, what? Like, now my oncologist had left the islands. It was like, nobody told me, right? So now I'm all in denial. I told Dr. Telkin, so that was the surgeon from Polymomi that did my surgery. I called him up and said, no, we're not doing the surgery. No, forget that. We're just going to do the radiation. That's it. Happily ever after. And then we ended up having a conversation. And then he kind of convinced me for like, hey, you know what, let's just go get this done. So that's what happened. I finally agreed to have it done, yeah.
Now, Guy, if you think back to what your health was like before your diagnosis, and if we could call that 100%, these days, after the two diagnoses, after the mastectomy, how close to 100% are you? Is there anything you can't do?
No, I can pretty much do everything the same. So, on the mental side, I'm a lot better now today because, I was able to, go see a therapist, work with a therapist for kind of help me get through that. Being involved with groups like this and be able to, listen and share stories together, that's very empowering for me. But overall, my health, I've lost strength. I'm not going to really, I'm 62. I'm not that young guy full of life before. So I really gotta watch what I do, but I still can do pretty much everything the same to a certain extent.
Now, it sounds like members of your family have been supportive of you, but sometimes it's good to get support from an external source. And I want to talk about one organization that has provided that source for you, that support for you, and that's the Breast Cancer Global Alliance, Breast Cancer Global Alliance, Male Breast Cancer Global Alliance. What has that organization done for you, and what can it do for others?
Well, for me, by this time, I was like a sponge. I was looking for help. I was looking for people that could relate with me because people that was in my circle, they couldn't relate. So they would basically bail out of my life and this is what I figured out after a while. The caregivers or people close to your friends and family, they feel so alienated because they don't know how to talk to you. They don't know how to support you. They're not going to tell you the things that you want them to tell you. And once they started to figure that out, that, okay, it's okay they don't understand. Okay, it's okay they're not going to be able to support me. Main thing, I know where I'm at and what I'm doing. That's the main thing. That's the main thing. But Male Breast Cancer Global Alliance for me has been such a life changer. I actually stumbled across it by watching this other guy that was a breast cancer survivor. And, without bringing up his name, we just kind of lost him a couple of months ago. He was just like me. He was a, breast cancer survivor, and he was sharing his story on TikTok. So I was just kind of watching him. And then, I noticed he was kind of talking about, Male Breast Cancer Global Alliance. And then he was, part of another group at what he was doing. So I followed him. And that's how I found, Male Breast Cancer Global Alliance. I was able to build a relationship with Sherry Ambrose, who's the founder of Male Breast Cancer Global Alliance. It was, started 15 years ago. It's a nonprofit. And it's really geared to supporting men like me with having a connection with other males that can share their journey together. So that's been a blessing for me. I try to be as supportive as them because we're you know, and I'm not going to discredit any other cancer group because all cancers is important, you know, but being the rarity of male breast cancer alone, we just stick out. You know, we just separate it from the pack. So I try to pay more emphasis on that.
And if someone wants to avail themselves of the support and the services that come from the Male Breast Cancer Global Alliance, their website, their web address is that's M as in Mary, mbcglobalalliance.org. Guy, I think we're going to wrap up now, but we're going to wrap up with the question that we almost always wrap up with, and that is, if you ran into someone who had just been, a man who had just been diagnosed with breast cancer, there might be a bunch of things you would want to tell him, but if there's one point that you would want to make sure that the point was driven home, one thing that person remembered when they walked away from you, what would it be?
First thing is get checked. You want to get checked and double check. You want to do that. You want to make sure you don't isolate yourself because the last thing you do, you need to be in your world. So you don't want to isolate. And, you know, that would pretty much be the same thing. You know, kind of let the people around you know what's happening, but really communication at that point and really double checking online and kind of seeing that, go to the, you know, Male Breast Cancer Global Alliance website. There's a lot of tools and information there that you could use. But yeah, that would be pretty much it for me. Yeah.
Excellent. Guy Nakoa, Wailuku, Maui, Hawaii. That's been a fantastic story from you today, a story that can inform and inspire. So, Guy, we want to thank you very much for being with us. Thanks for being with us on Cancer Interviews.
You're welcome.
And we want to remind you, as we always do when we conclude, that if you or a loved one are on a cancer journey, you are not alone. There are people out there like Guy. There are organizations like the Male Breast Cancer Global Alliance that can be there to help and hopefully ease that cancer journey. So until next time, we'll see you on down the road.